So, we have to study the skull and the bones in the head and neck region. So, the bones in the head and neck region is divided into two domains to study. One is the cranial bones, which is covering the brain and the central nervous system neural tissues area. So, we call them as neurocranium or brain box. Then we have the skeleton of the face, which is present in the face region, just like the nasal bone, like a maxilla, jawbone, etc., etc. Now, this neurocranium is also divided by two parts. It's having a base, we call them as this base of the skull or cranial base, like a lower part where you have the foramens, which is exiting through that nerves which is getting from the brain out, and upper part we call them as vault of the brain. So, it is vault or calvaria, which is the upper domain of this particular skull. So, if you cut this particular skull through this particular calvaria or the vault, you can see this particular cavity of the skull. So, this cavity of the skull can be divided off into three parts: anterior part, this is the middle part, and this is the posterior part. We call them as fossa. These are the cranial fossa or the depressions into which the cranial structures like a brain is lodged in. So, this part we call them as anterior cranial fossa, this one is the middle cranial fossa, and this one is a hindbrain part which is holding here, we call them as posterior cranial fossa. Now, if you look close, this particular skeletal bone, skeleton of this particular skull is having two layers, one is outside layer, other is inside layer, and in between we have a tissue which in between we have the osseous tissue. So, we call this outside is outer table or outer layer of this particular skull bone, or outer table of this or outer layer of the skull bone which is present outside. Similar to that, we have the inner table or inner side of the skull bone, and inside to it, in between them, these particular tissues of this osseous tissue, we call them as diploë bone or spongy part. So, this particular part of this particular skull bone, we call them as diploë, or this particular space, if it is occupying here, we call them as diploïc space. So, outer table, inner table, and in between diploïc spaces there. Diploïc space have got importance. When you go to the pathology, they will talk about the diploïc space, because this particular space was filled up with the marrows if it is required to. Jokhon dorkar pore, we see this diploïc space is generating some kind of bone marrows in it. So, this particular diploïc space then becomes thick or wide, or we call them as thickening of diploïc space. So, that particular thing is visible in in X-rays or in radiological pictures, which happens in case of the thalassemia, etc., etc. We learn about that particular thing in osteology, hematosteological part of the pathology, and of course in the pediatrics and surgery, pediatrics and medicine as well. So, diploïc space is occupied by the spongy bone, which can be grooming the bone marrow in it. So, if it is required, it can produce some blood cells, especially in some kind of crisis diseases. This particular diploïc space becomes like a really active and becomes thick. So, outer table and inner table is covered by a membrane, we call them as periosteum, which is covering of the brain region. So, outer table, inner table, and in between diploïc space. Diploïc space is having some kind of blood vessels present in it, so which is communicating with the outer table, inner table, and to the interior of the brain as well, and it may have some bone marrows in special conditions, like which presents as a hematopoietic organ. And this particular thing which you are seeing here in sciagram, like X-ray of the bone, we also ask you to identify outer table of the bone, inner table of the bone, and diploïc space. This particular diploïc space which you are seeing here becomes really thick in case of some diseased condition, which you are going to learn in pathology. Those guys are going to teach us. Widening of the diploïc space it signifies some diseases, especially in children. Anyways, these are the basic thing about things. Now, if we are just going to the name of the bones, we have this particular cranial bones which is present. We start from the frontal side, frontal bone, then we have parietal, then we have back side, occipital, then we have this on the side temporal bone, which has got like a different components, and then we have this particular in between we have the sphenoid, and in the central part also we have a bone, we call them as ethmoid. So, these are the different cranial bones which are present. Likewise, the cranial bone, we have the skeleton of the face or facial skeletons, which starts with this particular facial skeleton like a maxilla, nasal bone, lacrimal bone, vomer, palatine bone, and this inner side table bones of this particular nose, we call them as conchas. like that. So, we have to know different types of these particular bones, cranial bones, neurocranium and facial skeleton or facial bones. These are the things that you have to know along with the mandible, which special interest we have to know about. Amongst this all these particular bones, I would recommend to learn this particular mandible individually really well, because this is the only bone we usually pick up in the head and neck region. Rest of the bones will just like go for the views, we call them as norma. So, we will come into the norma. So, these are the facial bones. This is how it looks like nasal bone, lacrimal bone, zygomatic bone or cheekbone, which has a process going on the back side, which is known as zygomatic arch. And then inside this particular nose or nasal cavity, we have the nasal septum, nasal spine, which is present, and these are the concas or interior of these particular bones, which we call them as concas. Inferior nasal concha is the separate significant bone which is present, and deep inside, if you go out here in the deep side, we find this particular ethmoid bone, and in the midline, if you cut it open, we will see this particular the sphenoid bone deep inside. So, this is how if you split it and cut it, this particular lateral wall of the nose shows this particular breathing bones like a hanging hanging swabs, which is hanging like this. Superior, middle and inferior concas are there. This particular bone which is separating this nasal cavity from the oral cavity, we call them as palate or palatine bone. Hard palate, if you touch your tongue on the side, this is a palate bone, palatine bone. So, this is how it looks like, palatine bone. This is a bony part which is hanging down on the muscular part both side, and this is maxilla which is present in here. So, this is a cheekbone maxilla, and then zygomatic bone which is forming the lower part of the orbit and moving backwards, making the elevated part in this particular bone. So, whenever you are seeing this particular skeleton, you should be able to identify looking at this picture likewise the skeletal bone in the specimen as well. Now, coming to this particular bones as we are going to study. Now this is what we are going to study, like skeletal bone we are not picking up individually except this particular mandible, and if required, if we have time, then we will pick up some other bones which is important to us, but I do not see any rationale about identifying individual bones and learning the detail of it except the mandible. So, whenever you are seeing or looking at this particular skull, we look at the skull as a whole, and this particular whole we call them as views, or views of the skull is looked at how we are looking this whole skull from different views, like anteriorly or posteriorly or superiorly or laterally, etc., etc. So, this is how we call them as norma. So, if you are looking this particular skull from above, we call them as norma verticalis. From the front side, frontalis, back side, lateralis, basalis, which is basal part, like flip it. Then we are going to see the base of the skull which is there, and this part we call them as calvaria vault, and this part we call them as base, right, and this is a facial skeleton and the cranial skeleton likewise. So, we will take this particular views at a time and see what this particular views has to offer to us. This is the vertical look, how this particular skull looks from the top side. So, this is what we are just going to see. So, from the top side, if you are looking here, front side we see this particular bone, we call them as frontal bone. In this side we have these two bones, right and left parietal bones. Then back side we have the occipital bone. Important features on here is that we have a suture or joining of this particular skull bones are there. We call them as sutures or skull sutures. So, these particular sutures are fibroid kind of joints. We have learned this different kind of the synovial joint, syndesmosis, etc., etc. These are kind of fibrous joint. So, this particular joint which is sutural joint which is present in here, we call them as fibrous joint. In between them we have a narrow gap and it is bridged by some kind of tiny ligaments which are holding this particular element together. So, this kind of joints we call them as sutural joints or fibrous sutural joints. So, this particular sutural joints, you see that this is running from this particular frontal bone with this right and left parietal bone, and this is making a midline kind of like a union point. So, this suture we call them as coronal suture. Likewise, the union point of the parietal bone, right side and left side meeting together in the midline, they are joining here. This particular joining line we call them as suture, again we call them as sagittal suture. The meeting point of the sagittal suture with the coronal suture we call them as bregma. This is what you have to keep in mind. Bregma. What is sagittal suture? Identify that. What is parietal coronal suture? You have to identify that. And where we are going to find that particular point, we call them as bregma. Likewise, this particular bregma, we have another suture on the back side, which is holding this particular like a parietal bone with this occipital bone. We call them as lambdoid suture. So, lambdoid suture which is present on the back side joining with this particular midline suture which is sagittal suture in the midline over here, we call them as lambda. So, you have to know these landmarks, lambda and bregma or bregma point. So, these are the 2 points that you have to keep in mind in regard to this particular lambda, bregma. What do you know about that? Coronal suture, sagittal suture and lambdoid suture which is present in it. So, this is the thing which you are going to see this particular from above or above view. So, this is known as norma verticalis. So, for today we are going to skip this, we are going to talk about this view, we are going to learn about lateral view. So, which is rather easy compared to the other part. So, we call them as norma lateralis. So, we call them as norma lateralis. So, from the lateral side, lateral profile of this particular skull bones are visible. So, from this number of bones are visible. This bone over here, frontal. These are coming from behind. These are known as the sphenoid bone, the wing of the sphenoid. So, these are the things that you are going to identify. The sphenoid bone and the wings are visible in here. So, more or less we can identify this particular view. So, whenever you are going to see this particular views on the lateral side, whatever the things we are seeing here, we are going to see different types of cranial and as well as facial bones. Likewise that, then we have the mandible as well, which is visible on the lateral side as well. So, it is kind of like a bones we see on the lateral view, we call them as norma lateralis. Apart from this particular bones, we are going to see some kind of things. This is what we are saying here. This is what we call them as sphenoid bone. It looks like a bat, and this particular bat has got 4 wings. We call them as greater wing and we call them as lesser wing. Right side, left side, greater wing, right side, left side, lesser wing are there. So, if you take this particular piece of bone together out, remove these things out, it looks like this. This central part we call them as body of the sphenoid. In the body, in the superior part, we have a pocket in here. We call them as sella turcica. Where is it housed over here is the pituitary gland, or pituitary gland is put into this particular bony cavity over there. Then this one we call them as wing. This one is known as greater wing. Likewise, this greater wing, we have this wing. We call them as lesser wing, smaller wing, right? So, if you take this particular bone like greater wing, like this too, and lesser wing on this side, then we have this part which is like anchor part which is holding down, just like it is resting on this part. We call them as pterygoid plates. We have 2 of them, medial and lateral pterygoid plate. The medial one is skinny and lateral one is flat. So, we call them as pterygoid plates. We have 2 of the pterygoid plates are there. We are known as medial pterygoid plate and lateral pterygoid plates, right. So, these are the basic parts of this particular like the sphenoid. We have a piece of sphenoid like this, it looks like. So, this is how it looks like. So, whenever you are holding this part, we have the body, we have the cavity out here, and then we have this particular thing which is downside projections. We call them as pterygoids, 2 of them, medial and lateral pterygoids. Lateral one is broader like this. So, individually this is looking like this. So, if you cut this particular skull, look inside to it, it looks like this. This one individually we may give you to identify the basic parts of it, like that is what we mentioned about. So, these basic parts is body and wings, greater and lesser wings, and the pterygoid plates. That is what you have. In the body, we have a cavity that we are going to learn here. We call them as sella turcica, and we know the significance of sella turcica. What is housed in there is pituitary gland. So, if you have pituitary placed inside, it gives a shadow in the X-ray. If it is not putting any extra shadow on the pituitary gland, we call them as empty sella. We call them as empty sella. Sella is empty. In some kind of cases, the pituitary may be absent, destroyed in some diseases. Then in X-rays, it is not picked up. It is looking like a air space is lying there. We call them as empty sella. That is disease which is going to learn in obs gynae. But anyways, this is how, and looks like a bat wings. That is why it looks like a bat wing with this particular projections like this. Okay, this basic information that you have to know. Then we have this particular bone. This bone we call them as temporal bone. There are few features of the temporal bones are there. This part which is projected up, we call them as squamous part. We call them as squamous part. This one which is hanging down behind, we call them as mastoid part. Mastoid part we can feel here. This one which you are touching back side of your ear, mastoid process. where the sternocleidomastoid, this neck muscle is anchored to it, right. So, in front of this particular mastoid we have a foramen, this one, external acoustic meatus or auditory meatus, which is present inside. This auditory meatus have two plates, temporal plate which is present on this region. So, it has the tympanic plate and the temporal plate which is present in it. Then we have these projections going towards the zygomatic bone. So, zygomatic process of the mastoid which is going towards the zygomatic bone. So, this part of this bone is zygomatic bone. This is a zygomatic arch. So, zygomatic arch which is a thin bone which you are seeing here. This thin bone zygomatic arch is made by two bones. One part is coming from here, one part is coming from here. So, these two contributing together is making this particular zygomatic arch. Where is the zygomatic arch? Over here. So, cheekbone is this one, right. So, back side of the cheekbone we have this zygomatic bone. This is prone to fractures. If you have any kind of face injuries, especially the boxers and this kind of punch hit, these bones can be snapped, broken. So, this zygomatic arch is a thing which is running horizontally, can be broken if you have a impact over this particular cheek regions. Now, other than this, we have a petrous part of the temporal bone. This petrous part cannot be seen from outside. You have to look inside. So, this is a cavity of the skull, right? And inside the cavity of the skull, where you see this red arrow there. So, this red arrow is indicating towards this part. We call them petrous part of the temporal bone. If you cut inside, we open the cavity of the middle ear. So, middle ear, we have the cavity of the middle ear. Middle ear is divided into three parts. We have this particular like a external ear, middle ear and the internal ear. So, if you cut this, we get this particular cavity of the middle ear, and then we go inside further, we get this inner ear. So, we can get this particular inner ear like cochlears and all things inside to it, the petrous part of the temporal bone, and so the ear ossicles. Like inside the ear we have small bones, we call them as ossicles. Meniscus, incus, stapes, three of them are there. They are present inside too. So, if you crack this bone, we call them as petrous part of the temporal bone. That means it is empty, fapa. That means it has some kind of cavity to it. So, inside to it we get this particular bone, we call them as petrous part of the temporal bone, which is visible from inside only. The rest of these things are visible. Squamous part, mastoid part, temporal bone or acoustic meatus, and then we have the zygomatic process. Now, these are the thing. Along with that, we see that these skinny bony projections, right. These skinny projections we call them as styloid process. We call them as styloid process. Now, this particular styloid process and this particular mastoid process, there are two processes down hanging, right. So, this mastoid process and the styloid process, in between them we have a tiny slit, tiny foramen. That foramen we call them as stylomastoid foramen. Through that stylomastoid foramen, the facial nerve gets from the brain and comes out and reaches to the face. Facial nerve which supplies the muscle of facial expression, Shah Rukh Khan. So, that particular guy comes here, gets inside this particular mastoid process between that and styloid process between them, and it gets outside and gets into the parotid gland. Then it splits into branches, like there are 4 or 5 branches are there. You will learn that maybe, or we are going to learn that. So, that particular like slit between the styloid process and the mastoid process, we call them as stylomastoid foramen, right. So, these are important for us. So, this is what we have to know about that. Mandible, we discussed about mandible, so I can skip that. Now, coming to the sutures, which can be visible from the lateral side. 2 sutures is visible, we call them as lambdoid suture. This is the one which is joining with this bone, which is parietal bone, and with squamous, and this one is the occipital bone. We have this lambdoid suture, and then we have the lambda on the back side. We just learned about that. And then we have this squamous part of this particular temporal bone with this parietal bone joining here. We call them as squamosal suture. We call them as squamosal suture. And then is coronal suture. Half of it is visible on the right side, left side. So, 3 sutures can be seen from the lateral side. Squamosal suture, which is kind of like a suture between squamous part of the temporal bone with this parietal bone. Then we have this coronal one, which is joining this frontal bone with this particular coronal with this parietal bone, and then we have the lambdoid suture and lambda in the middle point, which is visible with the sutures out here. So, we have to know what are the sutures that is present in here. Now, other than this, there are some important features which are present to it. Now, then just let us keep these things a little bit. I want to talk about this feature beforehand we talk about anything else. Now, see that this particular union point like lambda and bregma we mentioned about, right. So, there are kind of union point here as well present. We call them as terion and asterion. So, union point over here is denoted with this P is terion and this with A asterion. Now, look into the bones which are joining in here making this particular union point terion and asterion. Who are making this terion? What are the bones coming together to make this particular bone? There are a number of bones are there. So, you see that in the front side frontal bone, from the back side parietal bone, from below we have two of them, one on the back side squamous part and sphenoid. You see that this part of the sphenoid which we call here coming in here, we call them as greater wing of sphenoid. So, sphenoid is coming over here. So, there are number of bone is coming in union point, we call them as terion. This is very important. You have to know what do you mean by the terion and what are the union of bones taking place at terion. 1, 2, 3, 4. Likewise, we have to mention, right. Now, this terion point is weakest part of the skull. I repeat, this terion is the weakest part of the bone. If you hit in this terion, it is invariably going to break. So, where this terion is there? On above this particular little posterior to this particular zygomatic bone and little posterior to this particular arch of this particular zygomatic bone over here, where you have the union point terion, right. So, on the sides, on the side profile we have a point where 4 of the bone are coming over here, frontal bone, parietal bone, sphenoid and this temporal bone, we call them as terion, which is the weakest part of the skull. If it is hit in this point, we get a injury to it. Deep to this terion, we get a blood vessel running in it. We call them as meningeal artery. We have an artery deep inside to it. We have an artery which is present in here. You see that? So, we have a middle meningeal artery which has 2 branches, posterior branch and anterior branch. The anterior branch runs over this particular terion region. So, if you have hit in here, this particular middle meningeal artery may be injured as well, creating some kind of intracerebral hemorrhage that we are going to learn very soon. But this point is very important. Very means very. Very means very, 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 because clinically very important. That is why they ask questions on it. Weakest part of the bone of the skull is terion. What is terion? 1, 2, 3, 4. What clinical structure lies in there? Meningeal artery. Meningeal artery has got 2 divisions, anterior, posterior. If you do not remember, just let go. Middle meningeal artery, right? Or if you cannot middle, meningeal artery. Sometimes middle thing, if you mention like sometimes it is very problematic, right? So, do not mention middle even. If you just remember the meningeal artery, it is fine. Just remember that. Now, coming from P, we are moving to A. What is A? Asterion. What happens in asterion? Union point. Again, what unites there? 1, 2, 3. 3 of them, right? So, 3 of them are joining here. Occipital bone, parietal bone, terion and asterion. Terion is more important than asterion. So, if it is less important, we are not going to memorize. We just remember the union point, terion, asterion. Remember? Good. Then we move to some features. So, in this lateral profile have got some areas over here. So, it gives some kind of lines over here, some imaginary lines. We call these lines as temporal line, superior and inferior. So, inferior and superior temporal line gives attachment to the muscle which is known as temporalis. What is temporalis doing? Is muscle of mastication. That means, if you are chewing here, this particular muscle is visible. So, this temporalis is attached to this particular lines which is present in it. Now, muscle which you are mentioned here is temporalis, is muscle of mastication. That means it would be supplied by which cranial nerve? Fifth cranial nerve, V. So, all the muscles of mastications are supplied by branch of trigeminal nerve or V, right. So, this is what we learned. So, this what we are seeing here, lateral side, we call them as temporal line. Below here we get this one, we get zygomatic arch. That means this bone, cheekbone, zygomatic bone. This zygomatic bone moves backwards. With this backward part of the zygomatic bone have got two parts. One part is contributed by this one and one part is contributed from here. Together they are making this bridge. We call them as zygomatic arch, right. So, zygomatic arch contributed by 1/3 and 2/3. Don't remember this 1/3 and 2/3. Just remember these two of the bones coming together contributing to the arch. One is zygomatic bone itself and then this bone, temporal bone, and temporal bone they are process having uniting here and making this. Clear? So, temporal line gives attachment to temporalis. Now, this temporalis muscle covers this particular which union point? Terion. So, deep to here we have a muscle which covering over here we have a fascia, we call them as temporal fascia or fascia temporalis, and then deep inside if you scrape these things out you get this union point, we call them as terion. In the terion what anatomical important structure lies here? Meningeal artery. Meningeal artery, if it is broken we get a intracranial hemorrhage which is deadly. We are going to talk about that very soon. Other than this we get this opening, we call them as external acoustic meatus. Then on the back side we get this bone, mastoid process. Mastoid process, deep to that we have some kind of vacuum space there, we call them as mastoid antrum or mastoid air cells. Then mastoid is an empty bone. You understand empty bone? That means inside to the mastoid we have cavity and within this cavity there are some kind of cells are there, we call them as mastoidal air cells. It traps air. Now, what this particular air is doing? Making the skull light. You get it what I am saying? Making the skull light. Why it is required to make the skull light, or else we cannot hold the head like this. You have to lift up the head, right, and then hold it high. So, you have to make this particular skull lightweight. To make this particular lightweight, that particular inside cavity of this particular bone is made of air. It holds some air. So, it gets some kind of loss of weight, right, and as well as it gives some resonance. That means, if you have air inside vacuum, give resonance to the voice. We can just like produce different kinds of voice and noises, whatever is required. That thing is coming from these air cells. So, this particular mastoid holds a triangular cavity. So, this particular triangle we call them a suprameatal triangle or McQueen's triangle. In ENT you will come back. So, for that time you can forget this, but I am just like introducing these things. Back side over here, if you have to do any surgery involving this mastoid region, if you have any surgery in ENT you are going to learn, then we approach to this particular triangle. Behind this pinna we fold it and go into maxilla triangle. We make this particular incision like this on top of this mastoid process and dig this particular bone, gets inside to this particular mastoid process, do the surgery and come out like. So, this is a guiding space where you call them a suprameatal triangle. We call them as McQueen's triangle. In ENT they ask question, long question about surgery on the McQueen's triangle or the mastoiditis surgery. So, this is the guiding space which is present in the posterior superior side of this external acoustic meatus. So, this is what is kind of less important, that is why I just like mentioning it later on phase of this part. But more important is that this particular point, terion, asterion and this. Good. Now, this is what we are talking about. Now, see, if this particular blood vessels is ripped, this particular ripping of the blood vessels can lead to this particular blood leakage into this particular regions. So, we have the brain covered by the meninges, and this particular top of the meninges we have this meningeal artery which is supplying this particular thing. So, this particular meningeal artery, if it is fractured or if it is broken, it gonna leak blood. So, if this particular blood is leaking and staying in some part of this particular in a meningeal space, we call them as hematoma. So, depending on where this hematoma is located, we call these names to the hemangioma, like hematoma. Like if it is above the dura mater, we call them as epidural, just like epidermis, and if it is below, we call them as sub. You get the logic? So we call them as hematoma. What kind of hematoma? Intracranial hematoma, inside the cranium, right? So these intracranial hematoma are of two types: outside the dura, epidural; inside the dura, subdural. Clear or not? Right? So depending on which of the blood vessels is ripped up, we get this particular hematoma. So epidural hematoma is this kind of hematoma outside the dura mater, which you are getting in here. So where is that? This one. So epidural hematoma is this one, which you are seeing here outside the dura. Blood vessels which are ripped in here, meningeal artery. Meningeal artery leaking this particular blood, and we get this particular hematoma's blood occupied in here, slowly getting bigger and compressing this particular brain matter from outside the dura, right? So this is easy to deal with because it's still outside the dura, not getting inside the brain or not getting inside the meninges. So what you have to do? We have to cut the skin over here. What you have the skin over here? Scalp skin. Cut the scalp skin, get this injury. If you cut the scalp here, we get this periosteum of the outer table of the skull bone. Then we get this particular periosteum of the skull bone removed. Then you get the skull bone and release that. The blood can be drained out. We call them as bar hole surgery. Man means we make a bar hole, like round hole on this particular region of the hematoma, and the blood will be coming out. We get a drill machine, we drill it with the negative pressure, it will be dripping out. We call this as bar hole surgery. Not required to remove the skull bone. Skull bone will be remaining inside. So we call this as epidural hematomal surgery, right? These things happens in case of the injury. Injury specifically happening in which region? Terion. Which blood is ripped out here? Meningeal artery is lying outside the meninges. It is lying on the top of dura mater. So if it is broken down, it is outside the dura mater, the blood is occupied. We call them as hematoma. This hematoma we call them as epidura, also known as extradura. Clear? Extra means clear? Similar to that, if this particular things are breached, blood is occupied between dura mater and the arachnoid matter. We call them as subdural hemorrhage. Subdural hemorrhage happens to occur if we have the blood vessels which is connecting the brain blood vessels with this particular outside. We have the sinus of here which is known as dural sinus. We are going to learn, like in meninges we have three layers. What are the layers? Dura mater, pia mater. So dura mater, within this dura mater we have some blood vessels. We call them as dural sinus. Dural sinus. That means the blood which are going to the brain coming through the sinus, through the blood vessels in the brain, which are venous blood. So venous blood channels in the brain we call them as sinus. This sinus we call them as dural sinus. Why we call them as dural sinus? Because they are present embedded within the dura mater itself. How many dura mater we have? We have two layers of the dura mater, outer layer and inner layer of the dura mater, which are present in the brain region. So this particular blood vessels which is present within this dura mater, the dural sinus, if they are breached, they are going to leak this blood. Now this blood is going to stay below this particular dura mater and they are going to press more blood inside to it. Clear? So this blood is a venous blood because dural sinus is carrying the venous blood. So this blood is a venous blood lying between this dura mater and arachnoid mater, and it happens to occur the vein ruptures. Which veins? Dural sinus veins. These are the things which is happening in here. Apart from that, it can happen another kind of bleeding. What happens here? We have the blood vessels which is supplying to the arteries which are supplying to the brain. We have the arteries. We have the anterior cerebral artery, middle cerebral artery, posterior cerebral artery, branches from circle of Willis. They are supplying those arteries. If they are ruptured, they can lead to the blood hemorrhage collections. We call them as cerebrovascular accident or CVA in short, which is commonly we call them as in layman's word as brain stroke. So, that kind of things also happens in these particular ruptures of these things and create some kind of blood accumulation inside. So, they are occupying that particular parenchyma of the brain, that means within the brain tissue itself. So, things getting little bit ugly right now, right, with this brain hemorrhages. So, two kinds of hemorrhages we are seeing here. One is parenchymal hemorrhage, that means within the brain it is happening by the cerebral arteries bleeding. Other bleeding can happen here which is occupied by this dura mater, extradural or subdural. Extradural, which is dura mater which is bleeding outside the dural blood vessels or arteries, middle meningeal artery for the common instances. Inside the dura mater, below this particular arachnoid, we have this particular subdural accumulation that happens if we have the venous accumulation of the blood. If it is ripped here, is dural sinus. This is a dural sinus. You see that this is a cross section picture. This is dural sinus. You heard this particular dural sinus name. If you name this, you may be familiar. We call them as superior sagittal sinus, SSS, inferior sagittal sinus. You remember cavernous sinus. Those are the dural sinuses. That means they are taking the blood which is brain parenchyma is getting through the cerebral arteries, taking the blood back. From the dural sinuses, it is getting to the veins. We call them as internal jugular vein. Then internal jugular vein draining to the heart through the joining with this particular right side, left side, subclavian vein, making this brachiocephalic vein getting to the brain. Clear? So, this is how the blood is circulating blood. So, this is what we are seeing here in case of this particular lateral profile of this particular skull region. Clear? Bones, cranial bones, visceral bones, that were what you are saying. Sutures, what are present? The suture union point, terian and asterian, lambdoid sutures, squamosal sutures, etc., those sutures and these particular points and the clinical points of this. They are kind of like a heavy element, but if you focus in these particular regions, it is going to cover this particular interviews and vivas or the clinical parts which is relevant to it. Subdural, extradural hemorrhage is kind of like an exam short note. They ask questions about this particular short note, especially this particular hemorrhages which is coming over here. So, young individual having a road traffic accident, falling on the side of the skull, hitting on top of this particular bridge of the like a cheekbone and getting injured, then having kind of fractures with the sciagram revealing fractures on the lateral side. So, what is the commonest side which is prone to fracture on the lateral norma views? What important structure lies in there? If you have the structure which is injured at that particular union point which is laterally, which is prone to have fractures, what kind of injury or what kind of clinical consequences may be leading from that part. Clear? So, this is how you are going to it. Similar to that, we have this particular clinical questions may be set up. So, middle meningeal artery is ripped for the fractures of this particular union point there. So, what kind of hematoma is expected to happen and where exactly the hematoma is located? That means they want to know in terms of the dura mater layer where this hematoma is occupied. That means inside dura or outside dura, right. So, those things they want to know from you. These are the very basic things regard to this relevant informations about terian, asterian and this hematomas, right, and this hematomas and these particular spaces which you seeing here. Okay, clear? Now, other thing which I am just going to briefly introduce out here is that we call them as spaces or fossa. We have these lines, we call them as temporal lines, superior temporal and inferior temporal line. So, here we have this particular space below this particular temporal line, we call them as temporal fossa. Temporal fossa is occupied by muscles. What muscles? Temporalis. Temporalis muscle, deep to that we have terion. Deep to terion, middle meningeal artery. Good, right. So, if you have temporal fossa here, we have to have a temporal fossa which is below the temporal region. So, we call them as infratemporal fossa. Where is this particular fossa located? You cut this zygomatic bone, right. So, zygomatic bone process is removed here. This is looking out here. So, below this temporal bone, we have this particular space which is lying in here. We call them as infratemporal fossa. That means it is covered by this jaw bone or cheek bone which is known as zygomatic process. So, zygomatic process ta jodi tumi remove kore dao from the side, if you cut these things, then we get this particular space visible. We call them as temporal fossa and infratemporal fossa. And infratemporal fossa chhadao, apart from that, we have another fossa which is deep inside. We call them as pterygopalatine fossa. That means this particular bone is maxilla. This is the pterygoid plate. You remember the pterygoid plate we mentioned about, which is the standing part, lateral and medial. So in between them we have a narrow slit which is present with the arrow out here. So that's groove between this particular maxilla palatine bone and this particular temporal the pterygoid plate. We have a narrow area, we call them as pterygopalatine fossa, also known as sphenopalatine fossa. It is limited by this greater wing or this pterygoid plate of the sphenoid bone. Backside we have the maxilla which is holding in here, and this palatine bone which is making the lower boundary of it. So it is deep inside. If you remove this particular like a zygomatic process, then only we can see that. So these particular spaces we should have an idea about. Out of these particular spaces, importance here is this one, temporal fossa, because there is visible, obvious. So it is obviously given the questions. Then if you can answer this temporal fossa, the examiner wants to probe more whether you are studying like little farther or not. If there any other fossa lateral like Norma has, like if we have temporal, we have infratemporal. If you can answer infratemporal, is there any deep fossa available there, which is known as like pterygopalatine. This is how the exam goes, right? So this is what we are preparing in this particular regions. This particular boundaries and everything over there, there are like complex things are there. I'm not going to mention these things, right? So this temporal fossa has the boundaries. I'm just not going to make you bore out here. So it is present here. Know the locations and know this part which is lying here. Temporal fossa has got important part over here. Point to remember, temporal is muscle with the fascia. That's what we are important for us, at least undergrad level. Infratemporal fossa, we have this particular fossa which is, if you remove this particular bone, then we can see this particular thing. Between this ramus, this part you remove, then we get the structures there. And then we have this particular super deep, which is pterygopalatine fossa. Remove everything, go to this narrow slit, this maxilla and this particular perpendicular plate of ethmoid. Then we have this particular limited by this particular like a palatine bone. Then we get this particular region, we call them as pterygopalatine fossa. We get a ganglion there, we call them as pterygopalatine ganglion. So which is important to us, like later on theoretically you have to know. But anyways, I will emphasize on only one space related to this region, temporal fossa. You know that, it's good for you guys, for the class at least. Okay. So see these particular individual bones, you should be able to identify it. Frontal bone, parietal bone, occipital bone with this foramen, temporal bone with the squamous, and the petrous part I am holding. This is deep inside, petrous part, and this styloid process, mastoid process, zygomatic arch, sphenoid, right? Individual bones you should be knowing. The basic parts of this particular bone you should be knowing. This is body, wings, and landing gear, pterygoids. That's it. This one basic parts you should be knowing: squamous, mastoid, opening of this external acoustic meatus, zygomatic arch. These are known as the plates or tympanic plates, which is lying in here. Then we have this inside part, which you call them petrous part of this temporal bone. This is spine. We call them as styloid process. Parietal bone. In this particular parietal bone, which is uniting in here, this particular lines which are present in here. So superior, inferior. This side as well, we have this superior and inferior lines of this temporal lines is visible. Temporalis is covering in these regions, which is the muscle of mastication. Then you should be knowing bregma, you should be knowing lambda, you should be knowing pterion and asterion. And what are the union of these things coming here in case of pterion? Pterion is a short note. Remember that, because it has this all these things like 4 bones coming here. Deep to that we have this particular weakest part, middle meningeal artery, and the muscle which is covering in that region is temporalis.